Now, the country's public health system is limping due to a shortage of staff, equipment and a brain drain, which has seen many healthcare practitioners leaving the country. It's made it difficult for the system to cope with demand, particularly during peaks such as the flu season or during the COVID-19 pandemic. Is national health insurance the solution? Well, to discuss this further, we are joined by the director of Mancosa's School of Healthcare, that's Paresh Soni. Thank you very much, Paresh, for your time here on ENCA. And I guess that's the question we always ask ourselves. Will we actually realize universal health as South Africa with our public health looking the way that it is?
Good afternoon, Maseko. Thank you for having me on the show. So I think that's a very important question right now. And I guess that there's two ways of looking at it. So the first way of looking at it is that the NHI is a utopian or an idealistic pursuit by the government of South Africa, one that brings pay to Section 27 of our Constitution, when everyone has the right to have access to healthcare services. And I think that on this notion, there's a lot less resistance or criticism about the NHI. And I think that we know that the NHI seeks to provide universal healthcare coverage for all South Africans. And from an idealistic perspective, the intention is great. But there are challenges. And if we have to look at it as one of the biggest projects South Africa has undertaken since the dawn of democracy, one where the lives and the quality of life of South Africans is at stake, then it's natural for us to become much more critical. So let's keep in mind that the concerns about the NHI and its rollout are shrouded by the recent state capture saga, the misappropriation of COVID funds, the mismanagement of large SOEs like Eskom and SAA, as well as the various provincial healthcare failures brought about either through corruption or a lack of budget. And I'd like to evaluate the NHI and its rollout and its chance of success from a project perspective. Okay, so when we evaluate it from a project perspective, we have the ability then to scrutinize it more objectively and leave aside any perceptions or misconceptions. So I think that every project needs a vision or an aim. And I think that on this requirement, we are clear. The aim of the NHI is to achieve universal health coverage, where the citizens of the country are able to access quality, affordable healthcare, where we have a single buyer system so that government can exercise its power in actually negotiating the purchase of healthcare services for its users. And thereby bringing in the affordability aspect. And then next we look at whether the project has an actual plan. And I think here too, we can argue that a fairly pragmatic plan has been developed, whereby the NHI was to be rolled out in phases over a 14-year period from 2012. But I think that, as the saying goes, the devil is in the detail. And when one starts to scrutinize the financing of this project, that is where things start to unravel. One of the burning questions is, how exactly is the NHI going to be quenched? How is the fund going to be replenished? And thus far, we've been told that a large portion will come from general taxes, redirecting tax rebates, and new taxes that target the wealthy. But you'll agree with me that in a country that suffers with one of the highest unemployment rates and such a small percentage of the total population actually paying tax, the funding of this model for the NHI is bound to be its Achilles heel. And then if we look at resources and capacity to support the execution of this plan, it's important for us to remember that 80% of South Africans, or more than 80% of South Africans, are already serviced by public healthcare facilities. It's only about 16% of the population that actually have access to private medical facilities. And if we have to look at the performance of these public healthcare facilities and their ability to actually meet the medical needs of more than 80% of our population, we see another issue emerging. In fact, South Africa currently only has one doctor per 3,000 citizens, We also have a critical shortage of
Yeah,
nurses
so
across
I have to
the
jump in there
healthcare
just
sector.
to also get the chance to ask you some questions, Paresh.
Sure.
So looking at the fact that South Africa is also a country that has a lot of medical legal claims against, especially and particularly the public health sector, so what are you saying in terms of, do you agree that the NHI and the paper actually looks good in terms of what government has discussed and put in black and white, but the realization of it is probably at zero because we have, like you said, patient staff shortages, which goes against what the WHO says we should have in terms of the patient ratio, the patient-doctor ratio in public hospitals, but also this issue that I'm bringing up about medical legal claims?
So I think definitely if we have to look at what the intention is, we are on the right track. However, when it comes to medical legal claims, there are a number of reasons for medical claims, especially within the public healthcare facility environment. And these can be attributed to healthcare worker burnout. Because as I've just mentioned, we've got one doctor per 3,000 citizens. At the same time, we have a critical shortage of nurses. There are bound to be these challenges where doctors are, nurses are, and other healthcare workers are because of being overworked, because the system is just not supporting them.
Yeah, all right. Well, I guess we're just going to have to deal with the fact that in South Africa we keep losing nurses and doctors to other countries because of other issues also, including how they feel abandoned by government in terms of payments, etc. Paresh Soni, he is the director of Mankosa School of Healthcare. Thank you very much for your time.